Hi, Dr. Kilgour. How are you?
Hi, Arielle. Nice to meet you.
Thank you so much for joining us. We're really honored to have you. You're such an expert in the field of dermatology. So, just to give everybody a little introduction on Dr. Kilgour, he graduated with honors from Cardiff University School of Medicine in the UK. He was a former resident physician at University of Oxford, specializing in dermatology and research. And he completed a precision medicine research fellowship at Stanford University, developing groundbreaking skincare therapeutics. So we are, so excited to have you because obviously Mama Soul is a 100% mineral sun care brand. So your expertise is so amazing for everybody who is listening. I wanted to start off with you telling us a little bit more about maybe your personal background and what led you to getting into this field.
Yeah, so I am a lifelong lover of cosmetic products and skincare products. One of my earliest memories is when I was 14 years old. I grew up in a small town in England, and I saved my allowance to buy a jar of creme de la mer, thinking that this was the ultimate skincare product. Jennifer Lopez bathes in creme de la mer, so I thought this was it. I saved my allowance. It finally arrived in the mail. It came in this beautiful big green box with tissue paper. It was absolutely glorious. And I remember opening it and being so excited, but also really stressed about how I was going to keep up with this regimen. Very expensive for a 14-year-old to buy. Uh, and I remember trying this cream, and it comes with a little spoon, and you have to, rub it in your hands and apply it on your skin. And I was thinking, wow, this is it. And it did nothing for my skin. Just talking from my own personal experience, it actually made my skin worse. I have rosacea, sensitive, prone skin. It's full of fragrance, and it just did nothing for me. And it was my first experience of kind of being disappointed by kind of the cosmetic industry and by a corporate America, and feeling like it didn't live up to its hype. And that experience, as funny as it was, really inspired this kind of lifelong passion for really understanding the science that goes into the cosmetic products that we buy, and really kind of a crusade for skincare products that really are a fundamental part of skin health. And that's really what led to my career, and becoming a dermatologist is really to kind of filter out the noise and find brands like Mama Sol that really live up to the claims and the science, and really put the formulation before the marketing. And so that's why when Ariel asked me to do this talk, I was so, excited and happy to do it.
Yeah, no, thank you so much. I love hearing that. And I couldn't agree with you more about not necessarily just La Mer or Creme de la Mer, but products just like that. I've had the same experience. And I also agree with you. Like, that's a big part of why I wanted to start Mama Soul, was to create something that was really effective, but also clean and does what it says it's supposed to do. So I want to just dive right in, start getting into the different topics that I have lined up for this conversation. So let me just ask you this. Do you agree with the statement, or do you lean towards one type of sunscreen over the other? The best sunscreen is the one that the patient is willing to use.
I think that is fundamental. I spend so much of my job is begging people to use sunscreen, and particularly people that probably should have used sunscreen and maybe a little bit on the late side. So I think definitely first and foremost, if you're willing to use any sunscreen, that is, the first barrier that we have to get over. And I would rather use any, approved SPF rated sunscreen than nothing. That being said, like anything in life, once you get over that first initial hurdle, then we can obviously go into specifics. And there are definitely better sunscreens and less good sunscreens. And certainly, first barrier is let's use a sunscreen. And then once you've kind of got over that step and you're using it, let's, see if we could maybe find a slightly more optimized sunscreen.
Yeah. That's great. That's a great answer. Do you feel like, what was I just going to ask you? Sorry, I was going to ask, I just had two questions to that. I'll just start off by saying, is it true that like natural oils like coconut oil can provide enough sun protection? Or like, can you tell us why that's so dangerous to say?
Yeah, so absolutely not. Slightly leading question, Ariel, but yes, no, you definitely should not use a natural oil and rely on that as a sunscreen. There is some evidence that some oils, like olive oil is kind of the classic one, can provide a little bit of an SPF, but really it's less than an SPF of 7 or 8 for olive oil specifically, which really isn't good enough in itself. But also when you're using any kind of natural oil, it hasn't been tested, it hasn't been rated with its SPF, so you really don't know what you're getting. And so even if theoretically olive oil could give you an SPF of 8, I mean, does it have to be extra virgin? Can it be Greek olive oil? We don't know, and that it hasn't been tested, and so it's just not something I would recommend. It's certainly not safe enough to do that.
Yeah, I think it's just been so scary seeing all of these influencers on Instagram spreading this information about, making their own sunscreen or just using straight coconut oil and things like that. And I really want those people to hear this.
Yeah.
There's so much testing that goes involved to make a sunscreen. I firsthand know that. And so thank you for answering that and explaining that, yeah, it could maybe give you an 8%, if that really. But I appreciate that. Um,
And I know that, people tend to think of natural as better, as being, safer in some ways, but I mean, we have science for a reason, and cyanide is perfectly natural. It's probably not something that you want in your skincare product. And so, using ingredients that have all the testing behind them, they actually have the safety data behind them too. And so, it's not always a case of natural is better.
yeah. So with that being said, do you prefer mineral or chemical, or what is your take on the two?
Yeah, in the US, and there are differences between sunscreens that are available inside the United States and outside because of the FDA. So within the US, I definitely prefer mineral sunscreens. The reason for that is that while both chemical and mineral sunscreens provide excellent UVB protection, and UVB is the rays of the sun that cause burning, and it's what the SPF refers to. The SPF is the protection from UVB. While mineral chemical, they all provide good UVB protection. The UVA protection by chemical filters in the US is really insufficient.
Hmm.
The most common UVA filter in US sunscreens and chemical US sunscreens is avobenzone.
Yeah.
The problem with avobenzone is it's not very photostable. And so you're using it to protect yourself from the UV, but UV breaks down avobenzone. And so it has to be stabilized by some of the other ingredients that they put into these sunscreens. Mineral sunscreens don't have that issue. Titanium, zinc, when they're in the sufficient concentration, they provide excellent UVA protection that's photostable. And so that's why I prefer mineral sunscreens when you're looking in the US market. They also are less likely to cause irritation. They are inert metals, so it's very uncommon, very unlikely to have any kind of skin sensitivity to the sunscreen filter itself.
That is the best answer I've heard, honestly. I'm really excited to share that information with our audience because I've heard things like that, but to hear it from a doctor is really profound. So I think everyone here will really appreciate knowing that. Okay. So some people believe that tanning oils with SPF are effective for protection. What are the risks of using them instead of just a lotion-based sunscreen, would you say?
Yeah, the problem is really how you apply it. So sunscreen should always be the final thing that you apply on your skin. In terms of facial skincare, the final thing before makeup. And we can talk a little bit about makeup SPF as well.
Yep, we'll get
That's a
there.
question maybe. But the problem is if you're using a tanning oil, if you apply the sunscreen and then the tanning oil, you're really disrupting the SPF, and so you're really not going to get the rated protection on the bottle. You could, in theory, use the tanning oil first and then put the sunscreen on. But really, your goal should not be to tan through sun exposure because any degree of tan means that the UV is penetrating into the skin. It's causing this hyperpigmentation reaction.
Yeah.
So you're getting sun exposure, and so you're seeing the aging effect and the skin cancer effect on your skin. So really, fake tanning is where it's at if you want to look more
Right.
bronzed.
I think
Um,
I'm taking it one step further where there's a brand, I won't mention their name, but they actually have a sunscreen oil with SPF. And I feel like you're not going to put enough of that on to get the SPF claim because you're going to look like you have just buttered your body up so much. You have to use a shot glass for your entire body, right?
And that is such an excellent point, Ariel, one that I am frequently telling my patients. It's probably the number one place that people go wrong with sunscreen is not using enough. And
Yeah.
so if it says SPF 50 on the bottle, that is through testing in a lab with a certain amount of the product. And so really, I think in teaspoons. I'm British, so we drink a lot of tea. So kind of for the face and neck, it's a full teaspoon of sunscreen, generally speaking. And then it's kind of a teaspoon or so for each major area of the body, each arm.
A
Um,
teaspoon for each arm, a teaspoon for each leg, that kind of thing.
yeah, a couple of teaspoons for the leg, and then a teaspoon for kind of each aspect of the
Okay.
trunk.
So a couple of teaspoons for the legs. Okay.
Yeah, yeah, the legs are a little longer. So it's really, that's kind of just a very rough, I like the shot glass amount for the body. That's also a good kind of rough quantity that I think is easier to visualize. There are these more precise, mathematical formulas, but who has time for that?
Yeah, exactly.
But yeah, to your
What
point,
do you
and
find is the biggest reason why people don't wear sunscreen?
I think there's a number of reasons. I think one is just the aesthetic effect. So finding the sunscreen that is right for your preference. Definitely in people with darker skin types, it can be an issue finding a sunscreen. A lot of the mineral sunscreens can leave kind of a white cast
Yeah.
that people don't like the appearance of. You can look kind of ashy and kind of unwell.
Mm.
Um, I think I really like some of the sunscreens that have kind of this imperceptible feel on the skin. I find that is particularly for some of my male patients is helpful because they really don't like the feeling of having something on their skin.
Right.
Um, my female patients are much more, comfortable with that. So that can be helpful. So I think first to your initial comment, finding the sunscreen that people like and will actually, able to use is probably the number one thing.
Yeah.
And then also I think just trying to integrate it into your regimen. So I always recommend that, if you're somebody that always brushes your teeth in the morning, which hopefully you do, maybe keep a sunscreen by, your bathroom sink or, by your car keys or just somewhere where you can kind of try and integrate it into your daily kind of morning regimen.
Yeah, that's great advice. And I do that myself because body sunscreen is something that before I started Mama Soul, I didn't really use every day. And so now what I do is I keep all because I use face sunscreen every day. That's not a problem for me. But the body was something like it was kind of an afterthought. And I think being transparent about that, even as a founder of a sun care brand, is really helpful to people. I don't want anyone to feel bad that they're not using it, but there's a way to encourage you to use it more, and that's to keep it in your bathroom next to your other products. And you put it on your forearms and your hands and your neck, at the very least in the winter, so that you're protecting the exposed areas. So I appreciate that.
I think also, keeping one in your car can be really helpful. A little tricky when you live in a really hot climate.
Yeah.
Obviously, I live in NorCal and in the summer it can be very hot, and so that can cause issues with the sunscreen. But when that's not an issue, keeping it in your car can be helpful. It's really hard to reapply to things like your hands. Obviously, if you carry a handbag, then that's a great place for after you kind of use the restroom.
Yeah. That's
Reapply.
that's that's a great point because I was going to actually bring that up also is like leaving it in your car does degrade the effectiveness of sunscreen if, on a hot day. But I think that's a really good point to say all the other months out of the year that are not hot, it's really that is a good place to keep it. So that's a good point. Okay. So why do people, let me ask you, why do people assume it isn't necessary on cloudy days to wear sunscreen and how much UV radiation still reaches us when it's overcast? Because we all know that the sun still reaches us. I mean, the UV rays still reach us during overcast days, but can you tell us like a little bit more about that and enlighten us on how much really is hitting our skin?
Yeah, so there are three wavelengths of UV. There's UVA, UVB, and UVC. UVC is filtered out before it even gets into kind of the Earth. It's filtered out by our ozone layer. So really, it's UVA, UVB are the ones that are important. UVB, the B stands for burning. It's what causes that kind of redness, that burn, that peel, all of that kind of stuff that we're familiar with. Those waves are blocked by cloud. And they're also blocked by glass. So if you're in your car, UVB is blocked by the windscreen as long as you have your windows up. So UVB and SPF in its technical term is not necessary on us on a cloudy day per se. But UVA, which are really the long wavelength rays, they penetrate. They penetrate cloud, they penetrate glass. I'm sat inside my office and it's a sunny day outside. There is UVA in this room. And UVA is interesting because historically we didn't think we always knew that it was aging, so the A in UVA aging, but we didn't think that it really contributed as much to cancer. What we found in recent times, it actually does. And it's actually very scary because UVB, when it hits your skin, it causes kind of DNA mutations that can lead to skin cancer. But as soon as you come out of the UVB, that damaging effect stops. UVA actually charges your skin in a way that is pro-cancerous. And so even for many hours afterwards, it's still having an effect on your skin.
Wow.
It's kind of called this dark process. And so basically, you go out in the sun for 15 minutes, you get exposed to UVA. For several hours later, that effect is still being felt in the skin. It's still having a pro-cancer effect. And so UVA is actually really, really super important, not just for aging and for all of those benefits that we want, but also for preventing cancer.
Yeah, and there's also that cumulative damage. So it's like people think that like, oh, they're just going to be in front of the window for an hour, but then they're doing that every day, and cumulatively that adds up to quite a bit.
Or if you're walking from your car to your office or, from your car to Target, every day, um, that all cumulative, that adds up. And there are different types of cancer of the skin, and some skin cancers, it's more about that sharp intermittent sun exposure. And so, in the UK, a lot of our patients would go to southern Spain on vacation once a year and they would get really badly burnt, and that can kind of lead to some cancers. But other cancers, it's actually more about that cumulative lifetime damage. And so when you get to your 70s and 80s, we really see the effects of that on people's skin, not just in terms of aging, but they just keep making cancers, and it can be extremely painful and difficult to treat once it gets to that stage.
Wow. I mean, not we don't want to scare people, but it definitely is a good reminder for me, especially to just really be diligent about covering my skin. I was going to get to this later, but I think this is a good time to talk about does does are you blocked? Does a sunscreen block you from getting sufficient vitamin D? And I'm sure there's so many people out there that is a big reason why people don't want to wear sunscreen because they think they're going to be vitamin D deficient because of wearing sunscreen. Can you just tell us a little bit about that?
Yeah, vitamin D deficiency is super common. And, this is kind of a long-held kind of discussion point is does sunscreen, reduce your ability to make vitamin D? I think actually, a lot of us have kind of some protective behaviors which are really healthy. And so we don't, sunbathe. We try to wear a hat. We don't, stand in direct sun. And so I think those behaviors do contribute to lower vitamin D levels. But the thing is, it's so easy to supplement your vitamin D. You can buy over-the-counter supplements. You can also get prescription levels. You know, vitamin D deficiency is super common, and it's definitely really helpful to get that supplemented. In my personal opinion, and medicine is always a risk-benefit kind of consideration. I just do not think the risk of a vitamin D deficiency, which is so easy to fix, is worth the risk of not wearing sunscreen and getting skin cancer. And so I I just do not believe that. It's such an easy fix.
That's an
So
amazing answer. I haven't heard anyone put it that way. And I think that's a really great way to compare the two lesser of two evils, in a way. One thing that I read was going out this is what I tell people. I'm like, if you're really concerned about getting your vitamin D, go outside around noon when it's high noon and for 15 minutes without sunscreen and just that's it and get your vitamin D for the day. What do you say to that?
yeah, I mean, I've had other physicians recommend that, and it's definitely something you can do. But yeah, I personally recommend that people just take a vitamin D supplement. A multivitamin, check it has vitamin D. Um, and if you're worried, everyone should have kind of annual labs from your primary care physician. So just have them add on a vitamin D lab as well at the same
How
time.
many milligrams would you suggest people take of vitamin D?
So it's in international units, and so I think it's about 25,000 IU daily is kind of a good kind of just kind of baseline, maintenance amount for kind of people that have a normal vitamin D level. If you have a deficiency, then they do much higher doses, and there's different regimens you can do. My husband is vitamin D deficient, and so he just did kind of the weekly several million dose, so once a week for 6 weeks. Very straightforward and simple to do, and his vitamin D levels are normal now. So it's really not a big deal, and I just, orders of magnitude, I would rather be vitamin D deficient than
Yeah,
have a
that's good to know. Okay, so the next question I have is there's a myth that sunscreen under clothing is redundant. What can you tell us about light versus dark clothing and the way it protects us?
Yeah, so it's really all about the material and the tightness of the weave and the color. And so, you can get UPF rated clothing, which is great if you spend a lot of time outdoors, if you're a runner. Look, getting UPF rated clothing is great. And you can be assured that if you're wearing UPF clothing, then you don't need to worry about sunscreen underneath the areas that are covered by the clothes. Um, no affiliation, but I really like the Target All in Motion range. It's super cost effective, and all of their pieces, to my knowledge, are UPF rated, UPF 50,
Yeah,
and looks just like Lululemon. So that's a great range to check out at Target. Um, but if it's not UPF rated, then you can't rely on it because you don't know.
sure. And I mean, what I've read is like a white t-shirt protects you like 3% from the sun. It's very, very little protection. Whereas maybe like if you're wearing dark clothing that are thick, what would you say for that? Like if you're wearing like just a long sleeve thin black t-shirt, would you say that that's you still should wear sunscreen underneath?
It really depends on the weave. So if it's, if you hold it up and you can't see through it, that's probably a good sign that it's
Okay.
sufficient protection. If you hold it up to a sunny window and you can see the light through it, then that, is giving you
Oh, that's great advice. Okay,
probably not a tight weave.
great. Okay, my next question is some people believe that a thin layer of sunscreen is enough or that one application lasts all day. Can you tell us what is the truth about reapplication and coverage?
Yeah, so there's a couple of factors. So one, if it's a mineral sunscreen, if it's a chemical sunscreen, it definitely in the US, it definitely needs to be reapplied. And that's going back to the point that the filters are not photostable, particularly for UVA. So literally the UV exposure will break down those chemicals, and so it will kind of exhaust the protection. Um, in other countries, they do sell kind of once a day sunscreens, and that's because they have different filters that are rated and more photostable. And so definitely with a chemical sunscreen, it literally is that the protection is getting exhausted by the UV, and so that's why you have to reapply.
Mhm.
If you get over that issue and mineral sunscreen doesn't have that issue, at the same time, if you're, really profusely sweating, if you're swimming in a pool, if you're toweling, if you're wiping your skin, you physically are just removing the
Right.
blood. And so again, that's why you have to reapply. If you're just, if you're somebody that wakes up in the morning and you work in an office and you don't do any really intense exercise, I think wearing a sunscreen in the morning and not reapplying is probably okay, especially if you're not going to go and, sit out in the middle of the park.
And
Uh,
does that go for both zinc and chemical?
I think definitely more so in the mineral
Yeah,
than the chemical, just because again, it's not exhausting it in the same way.
right.
And this is just my personal opinion, but I think, you don't need to worry too much about reapplying if you're really not doing anything to, you're not really sweating, you're not toweling,
Yes.
you're not washing your face, and you're not planning to be really intensely exposed to UV. Just for those kind of short trips, it's probably going to be enough protection and keep your skin healthy. But if you are going to go, after work on a long day and go in the park, then you probably should reapply in those
Would
situations.
you say that if let's say you're an avid mineral sunscreen user and you're putting it on and you're going for a walk and you sweat, it's water resistant. Would you say that because the FDA, kind of recommends that you reapply every 2 hours, would you say that with zinc you have a little more grace, a little more time to before reapplication?
Yeah, I personally would agree with that. I think again, the chemical is just we know that it's getting exhausted, and so with zinc, the concern is just that you're physically removing the sunscreen by sweating and toweling and those kind of things. We're
Mhm.
not worried about the integrity of the ingredient where you are with the chemical.
Got
So
it.
and you also have the issue with the chemical, again, that you may be removing it. So you have kind of two reasons why it may not be working.
Yeah.
Whereas with the mineral, it's a little more just physically, is it still on the skin and sufficiently covering the skin?
Yeah, that's real. I think that would be really helpful for people because I get asked all the time, if I buy a mineral, can I go longer without reapplying? And I said, well, it really depends on how much activity you're doing. But I would say yes. I usually say I give it up to 4 hours before you reapply if you're not doing anything strenuous, is what I have told people. But you're even saying you don't have to apply it again if you're really not doing much for the whole day if you're using zinc.
Yeah, and it really depends on the circumstances. If you are planning, you're going to the beach mid-afternoon and you applied in the morning, I would apply before going onto the beach because you're going to be exposed to a higher level of UV. And so I wouldn't trust the protection as much. But if you're just working in office and then your only sun exposure, other than through the window, is going to be walking back to your car for 5 minutes in kind of the
Right.
late day sun, probably you don't need to reapply, is
Yeah,
my
I think like a big benefit of mineral is that it works instantly. So like you even said, like if you're going to go on the beach and you were wearing chemical sunscreen, you have to apply it like 15 minutes at least before you go on to the beach. Whereas mineral sunscreen, if you get to the beach and you haven't reapplied it yet, it works right away, right? I mean, there's no waiting period for zinc.
But it works more as a physical block and it's reflecting, it's kind of like a mirror. It reflects the UV away from the skin.
Exactly. Okay. So, can you tell us the risks of people not applying sunscreen to places like your ears, your lips, the back of your neck, where people often neglect?
Yeah, so I see this very practically in my clinic. The most common places that I see skin cancers, the rim of the ear,
Mm.
huge. Scalp, particularly in some of my older male patients, is a huge place for skin cancer.
Mm.
Um, the back of the neck, yes, definitely. And then kind of the lips and then nose, very, very common.
Mm.
And then really, a lot of these skin cancers, melanoma is kind of its own beast, but a lot of these skin cancers, they don't spread typically, like other kind of cancers that we think about. So it's more, they're not as harmful in that kind of sense and life-threatening in that kind of sense, but they are harmful in the way that they are destructive and they have to be cut out. And the problem is you don't have much skin tissue in your nose. You don't have much skin tissue on the rim of the ear. The
Mm.
scalp is very tight skin. And so if you have to have a surgery to remove skin cancer in those areas, the repair is really where the challenge comes in and making it look normal again. And so often patients, unfortunately, depending on the size and how long it's been, they can be really challenging and sometimes they have to be grafted. And it can be really challenging to really go back to looking normal. And so you often end up with, scars. And, when you graft, it never is going to look exactly the same as the original tissue did. So, really the cosmetic impact can be quite significant. And so those areas that are really common are the worst areas to get a skin cancer,
But like
because
skin cancer can kind of appear anywhere in the body, right? Like, or do they typically appear where the sun hits your skin?
yeah, so again, depends on the type of skin cancer, but the most common are these kind of skin cancers that are cumulative. And so, for example, basal cell cancer, they are more common on sun-exposed sites.
Mhm.
Most melanomas also are more common on chronically sun-exposed sites. And so head and neck is a really common place.
Okay.
I see a lot of also forearms, backs of the hands, really, really common. And then kind of lower legs more in female patients is also common as well.
That's really helpful. Just again, just great reminders. Okay, so one of the most common misconceptions is that darker skin tones don't need sunscreen. What are the long-term risks of skipping sun protection for people of color?
Yeah, so definitely aging. Aging happens regardless of your skin type. And we know that 90% of skin aging is extrinsic. So that means it's coming from the environment. And UV is kind of the big thing alongside the environment and pollution and smoking and stress. Um, But definitely, people with darker skin types age, and sometimes they can age in different ways. And so sometimes they develop fewer wrinkles, but people with darker skin types can develop age spots, for example, more commonly. They can develop dyspigmentation, more commonly. Melasma is a huge issue in people with darker skin types, which is often in part driven by the sun and not just UV, but also visible light as well. And so definitely aging happens regardless of how light or dark your skin is. There is less evidence that sunscreen is protective against skin cancer in people with really dark skin,
Mm.
compared to lighter skin types. We know in lighter skin types, the evidence is super strong. It's as strong as we know that tobacco causes lung cancer. In darker skin types, the evidence is a little less clear, but I would still recommend it. It's for all of the aging benefits as well, and the
I've
fact that
never heard that before, that sunscreen doesn't protect people of color as much as lighter skin tones. That's so
it's
interesting.
just it's just there's less evidence to
Yeah,
support it. There's less evidence, and there are types of skin cancer in darker skin types that are more common in those groups that aren't sun related. And so, for example, a really famous example is Bob Marley, who died from an acral melanoma, which is a melanoma on the sole of the foot, and that's not classically sun related. It's not somewhere that gets a lot of sun exposure, and these develop in the absence of sun, and there are different mutations involved in that cancer. And so that
wow.
was a classic example.
What do you recommend for people of color then, if they just to really use hats and what can you?
I mean, I still recommend the same sun
Yeah,
protection advice. It's still good for the anti-aging benefits. And, just because we don't have the evidence doesn't mean that it's not helpful.
sure.
And, really we know that there's minimal risk to using a sunscreen, if any risk.
Right.
Sunscreens we have are safe, they're effective. They can have other great skincare ingredients, such as the Manosol products.
Yeah,
And so,
thank you.
uh, would recommend them anyway.
That would be great. Okay, great. So tell us now, we're going to talk about the SPF number on sunscreen. So does doubling the SPF number mean double the protection, or how should people interpret the difference between an SPF 30 and a 50?
Yeah, this is a great question. So the protection is not linear. The relationship is not linear. So it's not a case of when you double the SPF number, you double the protection. It's more of a curve. And so actually the difference between SPF 15 and SPF 30 is quite significant. The difference between SPF 30 and SPF 50 is actually very small. Don't quote me on the exact numbers, but it's around, I think, a 92% filtration with an SPF 30, and then it goes up to maybe 97 with an SPF 50. It's
I think
not,
we're at 97% with SPF 30 and 98% with SPF 50.
yes, Ariel, perfect. So it's really a small amount of extra protection in terms of the filtering. That being said, again, to go to our earlier point, you have to use enough of the sunscreen to get the protection. And so I generally think that it's easier to start with a higher protection. And if you don't use enough of it, maybe you get SPF 30. Whereas if you start with SPF 30 and you don't use enough of it, maybe you end up with SPF 15.
Right.
That's personally how I think about it.
Yeah,
And
that's a great
why I
way to
like,
think about
and
it.
why I think I personally prefer the higher the number, the better.
Yeah, for
So
sure.
it isn't, a doubling the protection as you said.
Right. Many people believe that a higher SPF makes sunscreen last longer without reapplication. What's the reality, and how often sunscreen we talked about should be reapplied, and how does SPF number relate to this?
Yeah, the SPF number doesn't really affect the duration. It's the same set of ingredients. And the same issues apply around physically removing it with sweating and toweling and things like that. But again, I personally always recommend the higher the number, the better. I think SPF 50, if you can use it and you have a sunscreen that you like, it's just better to use SPF 50.
Well, Dr.
Even
Kilgour, I read that if you start with a baseline of like 10 minutes, right? And that's when in 10 minutes you burn. So that's your baseline. And then you're using an SPF 30. And then so you do set SPF, you do 30 times 10. So you have 300 minutes that you can be out in the sun without burning, but you still have to reapply every 2 hours. Is that true?
Yeah, so that's how SPF was developed. It's basically the sun protection factor. So it's how many times, if your time to develop a burn is normally 10 minutes because of your skin tone and skin type, then it's the factor basically that increases. But in practice, I mean, this is more of a lab-based, kind of more theoretical test than it is something that is, the case in practice.
So you still recommend the reapplication. And that's what I tell people. I'm like, you still need to reapply as according to the directions, but that's theoretically what that means, right?
That exactly. That's exactly what it means, and that's how it's tested in the lab, again, under very controlled circumstances. So I don't think it's super helpful to think about it in terms of real life.
Yeah, that's great. That's great. Okay, so another myth that or something that I feel like I see all the time is the younger kids. Listen, I used to wear baby oil on my
Mm.
face when I was in Aruba when I was 16. I'll never forget my mom's look of horror when she saw what I did. But people, the younger generation really does still want to get a tan. I mean, even our generation still wants to get a little color sometimes. Does SPF block you're getting a tan?
I mean, it does, and it should. That's the point. Unfortunately, no natural tan is healthy, because it is a sign of your body reacting to the sun exposure that really you don't want.
Right.
And so, you know, definitely, unfortunately, fake tanning is the way.
Yeah.
Makeup, bronzing.
Yeah.
Um, that's really the way to give you that look without causing the damage to your
So
skin.
for those people who say, yes, sunscreen, you can still get a tan with sunscreen, but it's just going to prevent the burn. That's not right.
You can still get a tan with a sunscreen, but that's because you're not reapplying it frequently or you're going into UV that's too intense. Sunscreen is not a miracle worker. And so even with sunscreen, if you have very light skin and you go into very intense UV, you can still burn very quickly. You may not get 2 hours of protection. It just depends on the intensity of the UV, how directly you're in it, and your kind of your skin type.
That's really helpful. Okay. So is we talked about the vitamin D, which is really great. So does wearing sunscreen every day thin or weaken the skin over time, as some people fear?
No, it does the opposite. It protects the skin. We know that UV is the number one. It's number one, two, and three of those aging factors on the skin. Over time, when you're exposed to UV, not only do you have kind of that cancerous risk, but you have the aging effect. And really, how that manifests is that your skin cells stop working as well as they used to. They stop turning over, and so you can end up with that. So I guess technically, if you don't use sunscreen and you get photo age, then your skin will become thicker than if you do use sunscreen, but you don't want it to be thicker,
Right.
in that sense, because it's thicker because it's full of unhealthy, dead, dying skin cells that are mutated and
Right.
that are exfoliating correctly. And that's when you get wrinkles and age spots and dyspigmentation and rough texture, and your skin looks old. Um, and so sunscreen, in essence, protects you from that photoaging and so keeps your skin thinner, but it's thinner in a healthier way because your skin is working in a youthful way.
That was one of my favorite gems of this whole conversation. I love that. Thank you. Okay. So now we're going to talk about the type of sunscreen application, like powders versus lotions versus sticks and all those things, because so many people ask me all the time, what's the best application? I always say lotion is the best because you can really see how much is applying and make it as evenly as possible. And then I say, sticks are great for touch ups, but I'm really not a proponent for powders and things like that or sprays because I don't feel like you can really figure out how much is on you're getting, like how much coverage you're actually getting.
Yeah.
Tell us what you think about are powdered sunscreens or sprays as effective as lotions, and are there specific situations where they might not provide adequate protection?
I think this is a really great question. I think definitely if it's a case of if there's a specific form factor where you like it and you will use it versus not using sunscreen, then any form factor is okay. However, for better application and for more efficacy, definitely not all form factors are equal. I think a really common one, particularly for my female patients, is I have SPF in my foundation and my makeup. Is that enough? Unfortunately, unless you're really caking it on, it's probably not going to be enough.
That's what I tell everybody. That's what I
You
tell
would
everybody.
have to use so much of the foundation to get enough sunscreen that it's not cosmetically going to look good. And so, to that point, I think powders and makeup sunscreen is a great addition.
Yeah.
It's a great way of adding in a little extra protection and
Yeah.
just making sure you get full coverage from a sunscreen, but it's not by itself, unless you're really caking it on, it's not going to be enough. And so, that's where kind of a sunscreen that has kind of more of an imperceptible kind of a primer kind of function, like a lotion is going to be the best. Sprays, I think, again, are helpful in terms of trying to get people that don't use sunscreen to use them. But it's just really hard with a spray to really adequately cover the skin and get enough on the skin. And I see people all the time, at the park or the beach or, by the pool using these spray sunscreens. And I mean, it's just not going to be enough on your skin. And
No.
actually, the cost benefit, ratio is off because I think you end up wasting so much of that spray that you really have to go through it to get enough protection, and it's just not cost effective. An old-fashioned lotion is just going to be more cost effective, easier to use.
Yep. I couldn't agree more. I'm so glad you brought up the makeup because that's like a huge reason why Mama Soul has not yet done a tinted version. It's in the works for all those who are wondering, but it's something that we wanted to make sure that was used in tandem with our regular white sunscreen because, that blends in clear because of that reason, because you're not going to apply enough makeup onto your skin to get the protection it says. So I really appreciate that. I think that's super important for people to know because I can't even tell you how many people I know just only use their tinted moisturizer as their sunscreen for their face. Um,
It's better than nothing, but it's definitely not adequate by itself and
yeah,
not
like for
recommended.
the women, women really want to protect their face. I mean, that's everything, right? So everyone wants SPF 30 to 50. I mean, that's what we want. And if you're only using a tinted moisturizer and it says it has SPF 30 and you're not putting on enough, like you said earlier, it could be like you're getting an SPF 15 to 20 and not really an SPF 30. So it's a nice reminder. Okay. So for acne prone individuals, there's a belief that all sunscreens clog your pores. What ingredients or formulations should they look for to debunk this myth? And then are there any ingredients they should avoid?
Yeah, I think this is a quite a common myth. I mean, I think a mineral sunscreen, really is very safe to use on acne prone skin. Um it's really an inert metal, and actually zinc in itself can actually have some benefits in acne. It has some antibacterial effect as well. And so I think a mineral sunscreen is perfectly fine to use in acne prone skin. It's really more about the vehicle that it's in. And so it's not the filter itself, it's looking for the right vehicle, so the right kind of formulation, and avoiding something that's very hydrating, for example, with a lot of emollients that can be quite heavy for the skin and can kind of worsen acne. So going for something that has kind of more of a lighter sheer kind of vehicle to it is going to be better. So it's really not so much the filter, it's really the vehicle that it's in that's
And
the
are
issue.
there any specific ingredients that people come to you asking about for acne prone skin that they're like, should we not use this? Or is there any common ones that you hear?
I mean, just things like shea butter, for example, any of the more heavy, more emollient oils, definitely more of the kind of, yeah, like heavy moisturizing oils can
Yeah,
be.
that's helpful to know. Okay. So we talked about, not leaving your sunscreen in the car on a hot day, but on the cooler months, we talked about that being okay. But some people think that expired sunscreen is fine as long as it smells and it looks normal. But what actually happens to the sunscreen after it expires?
Yeah, well, when you formulate a cosmetic product, we do preservative efficacy testing. And so that's really testing it in a lab through an accelerated process to see how long the formulation is stable and essentially how long it's able to prevent the growth of bacteria and other, germs in the product. And so when a product has an expiration date, that's because that is when it is safe to use. That is inferred by when it was made and by the results of this testing. And so if you're using any cosmetic product, sunscreen included, past its expiration date or open best before date, it's really, you're going beyond what is safe. And so bacteria may have started to develop and grow in that system. It may start to degrade the ingredients. The product can also settle, and so you may not get the same amount of sunscreen filter in each pump of the product. And so it's just not recommended. It's not recommended. They have expiration dates for a reason.
Yeah, I solely brought this up to remind people to look at their expiration dates on their products because it is so important because it doesn't work after a certain date. I mean, it's just not going to work as well. We talked about sunscreen and makeup, so I really appreciate that. And we talked about why it's better to use a separate sunscreen, a regular lotion as versus a tinted. That was something I wanted to talk about as well. So everything that you have just said has literally, I'm so happy to finally talk to you. This is Dr. Kilgour and I have we've done a little partnership earlier in the year, and we have a special giveaway for everybody that's listening today. So thank you for everyone who is here. But before I do, does anyone want to just speak up and have any additional questions or comments that you want to make before we get into the giveaway?
Yeah, I'll put my camera on. That was awesome. Thank you so much. So informative. I mean, I thought I knew everything about sunscreen, but I don't. So I learned a lot. As far as damage that's already been done, I mean, I'm 44 now, and I definitely I've been taking pretty good care of my face, but like my chest and my knees and stuff, I'm noticing in a lot of places that I have a lot of damage that's already been done, and I don't know. So is there is there something that you specifically can recommend that can help that damage, that can renew, or is it all BS
Yeah.
aside from getting lasered?
Yeah, no, great question, Kayla. Definitely laser is an option. But I love retinoids and I specifically love prescription strength tretinoin. It's what I use myself.
Mhm.
That is why tretinoin works so well, is that it basically enters your cells and it basically activates what we call transcription factors. So it basically directly changes the genes that are being expressed within the cell. And so it directly activates the genes related to kind of cell health, cell renewal, and more youthful acting cells. And so it literally is telling your cells to act in a way that is younger and more healthy. And so definitely is a great, really well-researched ingredient to use, product to use to kind of um, renew the skin and kind of make it look and act more youthful. The important thing though is it does make your skin more sensitive to the sun. So sunscreen is ever more important when you're using any kind of retinoid product. But yes, and then acids as well can help because they can get rid of some of those dead skin cells on the top layer of the skin that kind of, as we age, they don't exfoliate themselves as well.
What
And
kind of
so
acids would you recommend, Dr. Kim?
anything from a glycolic acid, a lactic acid, the more like the PHAs, any of these kind of acids, I prefer a leave-on product.
What
Kind of
about like a hyaluronic acid? I use that a lot in my skincare.
hyaluronic acid is not an exfoliating acid like glycolic or lactic. It's more of just a hydrating acid.
Oh,
So good for hydration, but it won't help with kind of the other photoaging, unfortunately.
damn. Just spent a lot of money on that stuff.
Well, it will help in other ways and make your skin more plump. It can help. It's great for kind of when it's multi-molecular weight. It's great for plumping the skin as a kind of temporary benefit as well. So it can help with kind of fine lines too.
Okay.
So you would recommend retinoids even on your knee area and places all over the body?
Yeah, I actually have used retinoids, particularly on the forearms. I get a lot of patients who get kind of easy bruising and kind of brown spots just from years of sun exposure. And I personally have, in my experience, have found that has been really helpful in kind of making the skin look more youthful in those areas. So you can use it kind of really anywhere. I wouldn't use it in kind of sensitive areas, and it can be quite irritating. So you do
Yeah.
need to kind of, particularly with the prescription strength, obviously follow a physician's recommendations and treatment plan.
So Kathy, who's on this call, has a few questions. She
Sure.
said, are there foods or supplements that can create natural sun protection?
Yeah, so there is a supplement, a fun supplement, I believe from South America that does have some research behind it as giving you a little bit of a baseline SPF. And it's available over the counter.
What is it called?
However, it's called HelioCare is the brand. It's a type of fern supplement. but it's a very small SPF, and so it's certainly not enough by itself. It's still you still need to use a sunscreen.
Yeah.
It's good, I think, if you're going, for example, on vacation to Hawaii and you're going to be, surfing and getting a lot of sun exposure or
Yeah.
whatever, then it may be a good thing to add to your regimen alongside the sunscreen to get a little extra protection. But there's nothing in the research that shows that anything by itself is sufficient. You
And
always,
then and nothing to eat, like nothing besides that one thing. It's really there's just not a lot of enough evidence really.
yeah, there's really not enough evidence, and anything that does have any evidence would be a really low level protection.
Got it. That's really helpful. She also asks, would a mineral sunscreen packaged in glass hold up better in a warm car than a chemical sunscreen packaged in plastic?
That's a great question. I mean, I think in a hot car, any sunscreen is not going to be reliable. They're really not tested in that environment
Yeah.
specifically. And I don't know the relative benefits of glass versus plastic necessarily. It's hard to know, but
I,
it's not tested.
I would say, Kathy, to that question, I would be more concerned about the microplastics being released into the formula from the plastic in a hot car. I don't think I would never leave any product in a hot car. I mean, it's going to make it not as effective. It will degrade the active ingredients. But think about when you have a hot water bottle, those microplastics are being leached into your water. And it's the same thing with personal care products. And this is why this is a big topic for us as well. And like endocrine disruptors about how we've formulated our sunscreen, our face sunscreen and our lip in glass. And then our body sunscreen is in sugarcane. So it's not petroleum based plastic. So those are just little things to think about when you're buying your personal care products. And then her
And
last question.
some cars do have kind of overheat protection. So I have a Tesla and that has overheat protection. And so
Mm,
that can help. It activates at some, warm temperatures. And so that could help with the stability issue if you have a car that does that kind of thing. So that's one option.
yeah, that's
You
cool.
really have to leave it in your car.
She said, do mineral sunscreens have a longer shelf life?
Again, it really depends on the product, but generally speaking, they can do. But it just depends on the formulation. It's often not necessarily the filter, its expiration, it's the preservative system and how it keeps the product stable. That's the kind of limiting factor.
Yeah, I one thing that you can look for, Kathy, is the PAO, which is the period after opening symbol, and that will help you determine how long the product you can use that without it becoming going bad. So for our body and our lip, we tested for a 3 year expiration date, and the period after opening, we do a 3 year as well. So you just have to take a look and see. Does anyone else have any questions? Okay. So now we're going to get into the giveaway. So for those of you who don't know, Dr. Kilgour has his own, I would love you actually to talk about it. You have your own hair care serum line works for hair growth. I would love to hear about it.
Yeah, thanks, Arielle. Yeah, really, my brand came from this idea that we know the sun and pollution and environment is aging our facial skin, and it's why we develop wrinkles. And really applying that same information, we know that those same forces are aging our scalps, and it's really why over time we develop kind of this hair loss and this hair thinning that's kind of age related. In my clinic, I'm seeing ever more younger patients coming in with this really severe hair loss, and it's really from the growing research because of the environment and the way that our scalps are getting stressed. And so my brand really is a skincare system for the scalp, and it's really treating the scalp as a really important part of our skin for the first time.
And it's two different serums, right?
So we have one that's more of our preventative serum. It's not a sunscreen, but I like to think of it in the kind of the same way that it provides kind of that protection over time. And then we have a treatment product, which is really a drug-free alternative to things like Rogaine, that uses more natural ingredients that are still really clinically proven,
Mm-hmm.
uh, and really boost and densify the scalp and the hair and kind of make the hair look thicker and fuller and healthier.
Okay, well, I have a little bowl of names, and I'm gonna pick one out and see who gets the your line, and then somebody's gonna get something from Mama Soul as well. Okay, Kathy, Kathy, you won Dr. Kilgour's hair care line. So hi, Kathy is a unbelievable esthetician. She has been the head of the Grady schools in Boston of all the education. So this is, I'm sure she would love to bring this back and tell her esthetician friends about this.
Yeah, I'm super excited to send it to you, and please let me know what you think. I would love to hear.
Thank you very much.
Okay. So then somebody gets to pick well, somebody's going to get our sunscreen or something from our brand. Christina.
Yay!
Christina, you'll let us know. I'll ask you what you get to pick, whatever you want from the line, and we'll send that to you.
Thank you so much. And while I'm here, I just want to say thank you. This was incredibly informative and enjoyable and such a great experience to hear everything. So thank you so much for having me and for having your guest on.
Yeah, thank you so much. Honestly, I feel like talking about people don't know what to expect when you're talking about sunscreen and the mist. And I really did feel like your answers they weren't typical responses. They were really, like, I learned a lot. And
really easy for just a normal person to digest and be like, okay, that makes sense to me.
Yes. I really feel like I've learned, like I said, people look at me like I'm a sun care expert. And now, honestly, I feel much more so now that I've talked to you. So thank you so much. We loved having you. And I hope we can have you again in some way or another because you are awesome. So thank you.
Well, I really enjoyed talking to all of you guys, and I'm always happy to do another one on any skincare topic. And yeah, I have no affiliation with Mamasol other than I've met Arielle and tried some other products, and it's really a great brand and a great line of products. So
thank you. I appreciate that, Dr. Kilgour. Okay, thank you, everybody. And we recorded this, so we're going to be sending it out, and we're also going to have it live on our new Facebook group page, which we're going to be sending out an email about. So it's almost like listening to a podcast whenever you want. So you can access them in the car or whatever, and then you can send it to friends, anyone who might need to hear about sunscreen. So anyway, thank you so much, Dr. Kilgour, and we'll talk soon.
sounds good. Thanks, everyone.
Bye, guys.